Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about something that's becoming more and more prevalent in orthodontic practices, and that is non-binary tweens going through a transition, or teens, or kids, and how that maybe changes the orthodontic treatment plan and risks. So this is not something I have a lot of direct experience with. So, I mean, it's always a one-off, and it's great when parents are really forthcoming about the medications that their patients are on. So I did find a little bit of literature on this, so I'm literally going to direct quote what I found. The title, you can Google this, is called Gender Incongruence Dysphoria in Children and Adolescents Review and Implications for Dentistry. The authors are Mohammed Hania, Alice Roberts, and Mohammed Sharif. And basically, some direct quotes regarding the clinical management. They do recommend getting a medical release from the primary care physician or from whoever is overseeing the transition if they are on hormones. I mean, just from an outcome standpoint, I don't know. I mean, when we went to residency, they definitely would say, boys are supposed to look like this, girls are supposed to look like this, you know? So in situations where maybe we're class 3 or class 2, it might change the treatment plan a little bit because there was a boy look and a girl look. I don't think people do that anymore that much. I mean, maybe a little bit. Certainly, the most interesting part for me is if you're going to be doing growth modification for whatever reason, for small jaw, large jaw, small upper jaw, small lower jaw. If you're going to be doing expansion, if you're going to be doing vertical corrections, anything that is related directly or indirectly to puberty, that would be important to know, because obviously somebody who was born a female and who's transitioning into a male is probably not going to have their period. So that spot that we look for on a medical history is not going to be relevant. So but the bones still may be fusing, so they probably are very aware of how much growth they have left. But that's where you'd want to be interacting with the physician, because treatment timing is a big thing. And you need to time things right if you want to have the outcomes that you want. The other thing is they talk about because of the additional suspension hormone therapy suspensions that they take, there can be a fair amount of side effects, from liver function to high blood pressure. I don't know how much this directly, cardiac problems that can relate to moving teeth, but I think over time, more data is going to come out. So main thing is just to get your medical release and to have an idea of where they are in puberty to see treatment timing, when you're going to do things. That's pretty much all I wanted to say. All right, thanks.